Now, a Fox 21 Local News Right Now special report. Coronavirus. Facts, not fear.
Good evening, and thank you for joining us for this special primetime panel, Coronavirus Facts, Not Fear. I'm Scott Kilberry.
And I'm Taylor Bishop. First, the latest on the situation here in Colorado. A Weld County man in his 70s dies from the coronavirus, according to the Colorado Department of Public Health and Environment. This brings the statewide total deaths to 2. There's a new total number of 183 positive cases in Colorado. We've also learned Senator Cory Gardner is self-quarantining after close contact with a Coloradan who was visiting Washington, D.C. and then later tested positive for coronavirus.
Now, the coronavirus pandemic is impacting every aspect of our lives, and for many, the uncertainty of the situation is leading to anxiety, and for some, even fear. Well, tonight, our goal is to try and ease some of those tensions and fears, getting straight to the facts from experts who are in the know.
Now, we've assembled a group of experts and community leaders covering a range of topics from health, economics, and even education. So, as you can see from our unique setup, we are exercising social distancing, 6 feet between each one of us. And those panel members, we're going to introduce them right now. They include Colorado Springs Mayor John Suthers. Next to the mayor, we have from the El Paso County Health Department, Dr. Leon Kelly. Thank you so much for being with us, guys.
Also joining us tonight, Dr. Tatiana Bailey. She's the director of University of Colorado, Colorado Springs Economic Forum. She will address those questions you may have about the economy and your mayor. And then finally, representing our area schools that have been a huge impact, is the superintendent of Cheyenne Mountain School District 12, Dr. Walt Cooper. Thank you for being here tonight. So right out of the gates, we want to ask a question of the mayor. Mayor Suthers, can you tell us what would be the top priorities for Colorado Springs?
Well, first of all, thanks for having this forum, because obviously we want to get facts out, because people need facts. They need to listen to the health departments, not social media, things like this. So I very much appreciate this forum. Number one, from the city's perspective, we have to make sure we continue the delivery of necessary services. Police and fire services are absolutely necessary in a crisis like this, so we have to make sure we're continuing to deliver those services. Obviously, I have to look out for the safety of city employees. Some city employees are working from home. Some that have to engage in essential delivery of services are out delivering services, but we want to make sure we keep them safe. Our firefighters, our police officers are well equipped to keep safe. Thirdly, I, at the city, have to begin to prepare for the inevitable economic impact of this. We don't know how severe it's going to be, how long it's going to take, but we know for the next couple months at least we're going to have a severe reduction in revenue. And what does that mean going forward in terms of the delivery of continuing services, including public safety? So those are the priorities that we're working on at the city.
We want to move now to Dr. Kelly with the El Paso County Health Department. So to clarify any misinformation, we know there's a lot out there. How is the coronavirus different from the flu, the symptoms, severity, etc.?
Yeah, and that's a great question, and it really gets to the heart of what we're dealing with right now. And it's not obvious at first, right? They both are a virus. They both cause similar symptoms: cough, fever, shortness of breath. But that's kind of where the similarities start to end. The main difference is for 100 years, we've learned to deal with the flu virus. We understand it very well. We kind of have gotten really good at predicting what it's going to do every year. And we've created weapons against it, vaccines as well as medication. That's not the case with the coronavirus. This is a novel virus, meaning we've never seen it before. So no human being on Earth has ever experienced this virus. And so there's a lot of unknowns with what we're dealing with. When you have a flu virus, even a bad flu, you are able to limit its impact on our lives, because you can surround people who have the disease, with healthcare workers who you've vaccinated. And so you can shield the rest of us as those healthcare workers take care of those individuals. We aren't able to do that with this virus. And so our healthcare workers, our firemen, our law enforcement, our public health workers, all of those people are just as susceptible to this virus as anybody else. And that's why this particular virus, because it's new to us, has the potential to cause a much broader failure of the infrastructure of the healthcare system. We need our doctors and our nurses and our firemen and our EMTs healthy enough to take care of the people who really need it.
All right, thank you.
All right, our next question goes to Dr. Cooper. Now, schools have been closed this week. They will be closed next. We just heard news of a neighboring state in Kansas who has fewer cases of the coronavirus that have decided to close their schools for the rest of the year. What can you tell us about school being closed? How much longer do you think it will be closed, and when should it open?
Well, first of all, we were very fortunate in El Paso County that all El Paso County area districts share the same spring break. We made that commitment some 15 years ago. Because of proximity and crossover of staff and parents and students. So it was relatively easy for us to come to that decision to go out early this week, couple that with next week, which we were already scheduled to be off, and give really that 16-day window, including the weekends, to buy us some time while we were trying to figure this out. So just today, we learned that our original plan was that we would reconvene in the middle of next week, is what we've been telling folks across all the area districts, and reassess whether we could come back to school on March 30th or not. I think it's reasonable to believe we will extend beyond that. I think that we learned today that possibly by the end of this week we'll have some further direction from the state level regarding recommendations for school closure. But we're following the best advice of the best experts, and we will take that in incremental steps as this information is moving so quickly to try to project what a month looks like, or 2 months looks like, or quite frankly even 2 weeks at this point is very difficult.
Moving now to the economy, Dr. Bailey, with the stock market doing so poorly, how does that impact Colorado? Should folks, what should they be doing about their 401ks?
I say don't open your statements right now, actually, is what I'm telling most people. You know, history in terms of the stock market has shown over and over again that if you overreact, if you try to pull all your funds when things are this volatile, it doesn't usually pay. So it's better, I think, to focus on the necessities first. So let's first talk about prevention, public health. What can we do to flatten the curve, as the experts are saying? And then from there, obviously we also have to think about some of the downstream effects. Some of them are quite immediate for several industries, particularly the hospitality industry, transportation, and so forth. I mean, just today or yesterday, I think the airline industry asked for a $50 billion bailout, really, is what it is. So we don't know, you're right, what will transpire, but for now, the stock market, I'm not going to say is irrelevant, but it's going to be a ride. Anything above 15 or 20 in the volatility index, the VIX, is considered highly volatile. We've been around 70. So that tells me basically that we have as much uncertainty in the stock market and in what's going to happen with the economy as we do with the disease itself. So for that reason, I'm kind of putting that on a shelf, and then from an economic standpoint, trying to focus more on how do we help the people who need the help most.
Now we're going back over to Mayor Suthers. Now, you briefly touched upon this about the infrastructure. What precautions are being taken to ensure that the primary infrastructure like electricity, water, communication, food, etc. are functioning if the situation worsens?
First of all, I want to assure the citizens that we engage in contingency planning all the time for emergencies. Most of our planning, quite frankly, revolves around fire, flood, things like that, but we do talk about pandemics. I have to tell you, I think all of us are very surprised that the next emergency that we dealt with is, in fact, a pandemic of this nature and extent. But the utilities workers are, they're organized in a way that regardless of what happens, they will do what's necessary for the delivery of utilities. City police and fire are equipped, have the masks and gowns and things like that to do what they need to do, and we're, to the extent this extends and we need to get them more equipment, we will get that equipment for them. So from an infrastructure standpoint, in terms of the delivery of city services, folks can be assured that we will do everything we can. We'll get the cooperation of state and federal government to make sure that we're equipped to do our job for as long as it takes.
And moving now to Dr. Kelly. So with statistics showing suicide, car crashes, etc., having higher mortality rates, Why are we so concerned about the coronavirus? Why are we seeing such an unprecedented reaction across the world?
Yeah, and that's we can't measure this purely on mortality. Okay, the reality is yes, those things do happen, and people do die from those, and those are things that we chronically have to deal with and try to improve. But put this in perspective. 80% of the people who get this coronavirus are going to do just fine. They're going to have severe cold-like symptoms, maybe a flu, and they're going to do great. They're going to be sick for a few days, and they're going to stay home, and they're going to behave no differently than every other cold or flu that many of us had many times, all right? And so that's good. That's the good news, and that's part of reminding people that this isn't the time to panic. But also think about this. That means 20% of the time, people who are infected with this virus will be much sicker. They'll require a visit to the hospital. About 5% of that total is going to require severe intensive care, often ventilators and other types of support. And you think, well, that's still not too bad. So if 100 people get the coronavirus, that means 20 of them are going to end up in the hospital. And every one of our hospitals are very good and they can deal with that. But if you start magnifying that a little bit to 1,000, now suddenly you've got several hundred people who are showing up at the hospital. And then take that even more farther, and you can see if you have that happen over a very short period of time, which is what we've seen in other countries, car crashes don't all come in on the same week, right? They spread out over time. That's not what we're seeing with this virus. And that's why, as you hear a lot of us talk about altering the course of this, altering the curve and the peak, and that's what we're talking about. We're talking about spreading the infections out over time so that even the sickest of us are still able to get care.
Dr. Cooper, now would there be any consideration for students coming back to school in the summer months? Say if you have to make up time, and what do you do about those teachers and students that already had plans for the summer, if that is part of the plan?
Yeah, the question of how do we make up lost time really is one of the fundamental questions that we're dealing with, because there really is no effective way to replace the time that we're missing right now. Remote learning, extended school year, starting next school year early, all of those ideas have been bandied about a bit. And we'll continue to look at those and evaluate those. Obviously, a lot of that is dependent on how long we are actually out and what time we're actually trying to make up. But there really is no direct correlation between adding time and making up time. It just doesn't work that way for the things you mentioned. So, you know, if it's safe to go back to school in the summer, that means it's safe for folks to do all the other things that they would ordinarily do in the summer. And quite frankly, after being pent up or restricted significantly in their daily life activities for weeks or a couple of months, many folks will make that choice, as likely they should. So it really is a matter of taking this one step at a time based on how long we are out and what we can do to really have some measure of continuous learning during the time that we're out, and not thinking so much about how do we make up that lost time on the end of something else.
All right, Dr. Bailey, this one's for you. Now, as we've seen over the past 24 hours, really with many businesses forced to adapt, completely close altogether, how does all of this impact loans, and what kind of programs are available for small businesses or those who experience temporary job losses?
Well, I think most people are familiar with what the Federal Reserve has done. And, you know, initially you look at that and you say, well, how does that really impact me personally? But truly it's more of an upstream type of approach in which the Federal Reserve is trying to make money available to businesses so that they don't have to lay off employees, so that they don't default on loans as much. And, you know, first we had a 50 basis cut about a week or so ago, and then on Sunday another cut. So we're at pretty much zero. So that's on the monetary side. On the fiscal side, phase one was, you know, $8.3 billion that the Trump administration stated that they would put out there really for vaccines, for you know, making testing free and so forth. Now that looks big, but a few days later, as in today, $850 billion is now what's being talked about. Up to almost $1 trillion is the latest estimate that I've heard for additional measures, and that's going to be, you know, it could be payroll tax cut. That one is a bit contentious. It's definitely going to be an extension of unemployment benefits and so forth. So we know that some of these things are now kicking in. As an economist, I'll be honest, I worry a little bit. Most of the other downturns that we've had have really focused on one sector. When you think about the banking industry or the tech bust, right? This one, it's really hard to imagine any industry that's not impacted. So, you know, at what point can we continue to, you know, push for these types of stimulus packages? So, you know, that is a question that's out there. But what can we do in the interim? And I think your question is a good one, because day to day, even within our own community, you have a lot of businesses that are saying, I can't go a week without having people come into my doors. So, you know, we do have some emergency funds that are out there. I think Governor Polis has actually done an amazing job trying to open up some more resources for Coloradans. Even here, Pikes Peak SBDC has on their website all kinds of disaster relief information for small businesses. The Pikes Peak Workforce Center also has been working around the clock in terms of trying to help individuals file for unemployment claims. And they have all kinds of suggestions as well. And there's actually a small group of us that are coming together trying to figure out, well, how do we make these resources as apparent and as available to, you know, to our fellow people, our neighbors, the businesses that we frequent. That's what we can really impact for now, and I think that's what we probably have to focus on. Thank you.
That's some good information. And Mayor Southers, this question is for you. Similar question along the same lines. This one particular from Bob's Discount Mattress asks, how do businesses get assistance during this time to keep the doors open, pay employees, and pay taxes?
Well, unlike the numbers that Dr. Bailey just gave, all these very large federal numbers, City of Colorado Springs has a budget of $330 million. 73% of that is wages to city employees. We do police, fire, public works, transportation, and parks. As a practical matter, the city is not going to be the source of money to assist small businesses. It's going to be largely dollars and cents from the federal government in the form of these large packages that Dr. Bailey is talking about. I think we're going to see packages from the Small Business Administration to help small businesses. I think we're going to see, obviously, unemployment. I think hourly wage earners. One of the things that's being talked to about today is actually sending every American worker a $1,000 check. So as a practical matter, it's the federal government that doesn't have to worry about a balanced budget that's going to deliver these programs. The City of Colorado Springs, which by law has to have a balanced budget and has to deliver police and fire services and these other basic services, is not going to be the source. But we're going to work with the state of Colorado. We're going to work with the federal government, make sure that our citizens know what's available to them. We're going to work with the workforce development folks and SBDC that Dr. Bailey just talked about. So I think small businesses, as this package comes out of Congress, will become very much aware of what help is available.
Mayor, thank you. You are watching a Fox 21 News Primetime Panel special, Coronavirus Facts Not Fear. We're going to take a brief break, be back with more of your questions.